So today we'll talk about American Indian and Alaska Native health issues. Here are a few facts to ponder about the history of American Indians and Alaska Natives, which contributes to some of the health issues we see today. European settlers brought with them diseases for which American Indians and Alaska Natives had little or no immunity. American Indians and Alaska Natives have endured inferior housing, education, and high rates of poverty. The history of maltreatment of American Indians and Alaska Natives in America has led to the mistrust of the U.S. government. These events in aggregate have had a negative impact on the health and social status of American Indians and Alaska Natives. Some of this was described in the American Indian Alaska Native reading assignment for this week. More of this should become clearer once we arrive to the end of the lecture, including your viewing of a film to help illustrate the context of one of the major health issues for this group. From a population standpoint, American Indians, Alaska Natives represent less than 1% of the country. However, of note is that number represents those who identify as American Indian and Alaska Native only. These numbers should be underreporting or could be underreporting when you consider the proportion of persons who select two or more races. Also, there are nearly 600 federally recognized tribes in the United States, with several still more active in South Carolina. Additionally, there are over 200 languages spoken among the population. With that said, here are the leading causes of death table. What causes of death do you know in particular for this group? We see that the top two causes include cancer and heart disease are the same as with African Americans and whites. Unintentional injuries is ranked at number 3. Diabetes is a major health issue tied with that of African Americans at number 4. Cirrhosis makes the list for the first time, ranked at number 5, and suicide is the highest on the list compared to any other racial ethnic group at number 8. Let's take a closer look at what is going on with our American Indian and Alaska Native population. The American Indian Alaska Native reading assignment by Jones this week provides a historical perspective on the health and disease burden of American Indians. A variety of explanations existed regarding the cause of American Indian health disparities, such as genetic inferiority, poor sanitation, nutrition, behavior, lack of civilization, and providence. Jones also describes the historical patterns of injustice through colonization that contribute to past and present day health disparities among American Indians. Jones also notes that according to a recent Indian Health Services (HIS) report, American Indian health disparities in life expectancy and disease are due to socioeconomic and cultural differences. How does this differ from what we found with African Americans? Regarding healthcare access and utilization, the Indian Health Services (IHS), established in 1955, has as its primary mission the provision of health care for American Indians and Alaska Natives. However, access to IHS facilities is limited due to geography and funding. Facilities tend to be located in highly remote areas and cover vast geographic areas. Also, there are limitations due to funding rations, so that some services are not available at all facilities. Some major health risks to note for American Indians, Alaska Natives include environmental exposures and poverty, low SES. Some environmental exposures can be connected to living off of land in areas where there may be exposure to toxins in the soil due to proximity to nuclear test sites or solid waste. This can then lead to ingested exposures. For instance, if you have cattle and vegetables growing in toxic soil and then you feed off the cattle or eat the vegetables, that can lead to exposure. With our African American population, we already described how poverty and low SES can lead to socio-environmental risks that can then lead to poor health outcomes. Much of this translates similarly to American Indians and Alaska Natives. Other major health risks include language and culture as barriers to quality of healthcare. This can manifest in terms of cultural insensitivity of healthcare providers, whereby Western providers tend not to accept traditional healing practices and traditional medicine that may be espoused by some American Indians and Alaska Natives. Also, American Indians and Alaska Natives may be less inclined to disclose their use of traditional healing practices, leaving the position to diagnose and treat without information that may be important to prevent dangerous drug interactions or to properly diagnose diseases. That said, there has been some research to show that persons who maintain their culture actually have fewer disease risks. If you will recall, unintentional injuries were the third leading cause of death for American Indian Alaska Natives. Some of these injuries are linked to rurality, emergency response, and alcohol consumption. For example, for those who live in rural or remote locales where access to health facilities may be limited in the event of an injury occurs, the time that it would take for emergency response is limited. Is far greater than in some rural areas. Given this, the same injury which could be addressed relatively quickly in urban areas could turn fatal in a poorly resourced area where access to emergency facilities is limited. Also, there are connections to farming or agricultural work could also lead to unintentional injuries regarding equipment and such. American Indians, Alaska Natives, are more likely to exceed alcohol consumption guidelines, which are more than 14 drinks per week for males and more than 7 drinks per week for women. We see that alcohol consumption can be related to not only unintentional injuries, but also cirrhosis, ranked 5th leading cause of death for American Indian Alaska Natives. It is interesting to note that there were actually no cultural ties with alcohol prior to European migration to North America. Also, use of alcohol can be related to stress associated with the social context of living as an American Indian Alaska Native in our country, some of which was described by the historical perspective slide for this lecture. Additionally, there is a well-known myth that alcohol use among American Indians and Alaska Natives called the firewater myth. It is this theory that American Indians are more sensitive to the effects of alcohol. We see growing research that this is not necessarily true. So here's that question for you again. Given this information, how do we address health disparities among American Indians, Alaska Natives? What innovative ideas do you have to address the issues of poverty or unintentional injuries or diabetes among this group? There is some data to help with assisting and offering support and treatment for American Indian, Alaska Natives. I mentioned earlier that there can be some cultural insensitivity among healthcare providers as it relates to treatment and care for American Indians and Alaska Natives. I particularly appreciate these guidelines because they are practical. According to researchers Broom and Broom, here are some suggestions. Everything from how to be responsive to nonverbal communication to maintaining physical distance. And here is a continuation of the list from acknowledging that spiritual health is tied to physical health and that respect for culture is paramount. So in conclusion, there is a harried history for American Indian Alaska Natives in the U.S. that may be linked to present-day health disparities. There are a variety of major health risks among this population that have socio-contextual causes that are important to recognize. And there are some practical suggestions for interacting with American Indian Alaska Natives that may assist healthcare providers in working with this population.